Ever wondered how to recognize and respond to life-threatening situations in chest trauma? Well, the answer lies in a systematic approach of assessment and treatment. In the wake of chest trauma, some key signs to watch out for include severe respiratory distress, altered mental status such as disorientation, disproportionate anxiety, and drowsiness. Other red flags include a weak or absent radial pulse and cold, clammy extremities. If these signs are present, it's time to take immediate action. A needle decompression could be the first step in the intervention. This procedure involves inserting a needle into the chest to relieve pressure that may be building up due to a collapsed lung or other chest injury. But how do you know if the decompression was successful? There are several signs to look for that can indicate success. First, there might be a gush of air upon insertion of the needle. This means that the pent-up air in the chest is being released, which is a good sign. Next, the patient's respiratory distress should begin to resolve. You should also see a resolution of shock, a return of consciousness and pulse, and an oxygen saturation level of more than 90%. And of course, safety should always be ensured during the procedure. Once the immediate threat is addressed, it's crucial to assess the patient for other injuries. Administering antibiotics and pain medication is also an integral part of the treatment plan. But what if the patient is still in shock? In this case, preparing the patient for transfer while continuing monitoring is the best course of action. In situations where medical personnel are unavailable and the transfer to a hospital will take more than 6 hours, repeated needle decompression, chest tube thoracostomy, or finger thoracostomy followed by a 3-sided occlusive dressing might be needed. To summarize, recognizing life-threatening situations in chest trauma involves being vigilant about certain key symptoms. The treatment process is a step-by-step procedure that begins with needle decompression in case of severe symptoms, followed by assessment for other injuries and administering necessary medications. If the patient remains in shock, preparing for transfer while keeping a close eye on the patient's condition is the next step. In dire circumstances where medical help is far, repeated procedures or other interventions may be required. So remember, the key to successful assessment and treatment of chest trauma lies in observation, immediate action, and constant monitoring. Understanding these steps can make a significant difference in life-threatening situations.